this video, I am going to demonstrate the surface marking of axillary artery and brachial artery. To mark the axillary artery, I have to abduct the arm at 90 degrees. I am abducting the arm to 90 degrees. To mark the axillary artery in the axilla, first feel for the collarbone clavicle. Okay, so clavicle can be felt throughout as it is subcutaneous. The first point to be considered to mark the axillary artery is the midpoint of the clavicle. So this is the midpoint of the clavicle. This is the first point. To mark the second point, first you feel for the posterior axillary fold and the lateral wall of the axilla. This is the lateral wall of the axilla. This is the posterior axillary fold that is formed by the latissimus dorsi muscle. To mark the second point for the surface marking of axillary artery, mark a point at the lateral wall of axilla just in front of the posterior axillary fold at the lower end. So this I am marking as the second point. The first point and the second point should be joined by a straight broad line. So this is representing the axillary artery in the axilla. The brachial artery is the continuation of axillary artery. So axillary artery continues downwards in the arm and the name of the artery is the brachial artery. To mark the brachial artery, the first point is at the lower end of lateral wall of axilla, just in front of posterior axillary fold. So this is the first point. The first point of brachial artery is the second point what I mentioned when I mark the surface marking of axillary artery. The second point should be in the anterior median line, just at the level of neck of radius. Now to feel for the neck of radius, I am flexing at the elbow joint 1 centimeter below this bend at this region. See, 1 centimeter below this end lies the neck of radius. Now feel for the tendon of the biceps. So when I flex, one tendon becomes prominent. I can grasp this tendon. This is the biceps brachii tendon. So mark the second point at the anterior midline, just medial to the tendon of biceps, 1 centimeter below the bend of the elbow. This is the second point. Join the first point and the second point by a line. This is representing the brachial artery in the arm.